Hello, I'm Jane Burns and I'm the Medical Director in NHS Lanarkshire. I've worked on the board for a long number of years and I've always been proud to say that, but I've never been more proud of working with such fantastic teams throughout the course of this pandemic. You've all gone above and beyond the call of duty and your contribution has been truly exceptional. I singled out a couple of areas when I spoke previously in the week about critical care and primary care, but I wanted really to give a general thank you to everybody, because everybody has made their own unique contribution to the delivery of us managing to safely reach what we feel is the peak of the pandemic for NHS Lanarkshire at this point in time. So whether you're a porter or a domestic or a member of admin staff, whether you work in primary care or secondary care, whether you work in the very intense areas of critical care, or you're somebody who has changed your ways of working in order to support the number of patients attending hospital, we want to say a huge thank you to you. I particularly want to say my thanks to all the staff who are working in the care homes and to all of our staffs across the community who are helping to support the care homes, look after their patients. There's more to be done, but I'm really pleased to see the amount of work that is being done to help that very vulnerable group of patients who need our support and our consideration at this time, because to end up being admitted to hospital from a care home can be a very, very traumatic experience for a frail elderly patient and for their family, where it can feel quite frightening. So well done to everybody for helping to support that. I'd also like to say a thanks to people who have not been working with the COVID-19 patients specifically, but those of you who have been trying to maintain other services that are absolutely essential for the health of our population. So I know that many of you have changed your ways of working to support that, but have continued to achieve excellence in the care that you've delivered, whether that's for our stroke services or for those of you working in our cancer services, where there have been some very difficult conversations to be had with patients about the nature of the balance of risks that they face with slightly amended treatment plans because of the circumstances that we've faced within the pandemic. So thank you to all of you for the work that you've done there. I'd also like to acknowledge that it's important for us in healthcare to say thank you to all the people who stayed at home and who've stood by the lockdown and made such a difference. But I know that that actually brings a further complication for all of you, that when you've had a difficult shift, that your normal de-stress mechanisms are maybe not there and you've had to go home into a lockdown environment. So I want to ask you to continue to support each other, to make sure that you get your breaks at work, to make sure that you stay well hydrated, and to use the checkout lists that are there at the end of your shift to help you to de-stress as you go home and try to get some rest and relaxation before coming back to work. Last night was Thursday and there was a clap for carers once again. What I would like you to do is next Thursday I'd like you to go out and join in that celebration and clap yourselves, congratulate yourselves and your colleagues, and be immensely proud of what you do, just as I am proud of every single one of you and proud to be part of this team. Thank you.